Well, hi everyone. I'm Daniel Williams, Senior Editor at MGMA and host of the MGMA Podcast Network. We are back with another Business Solutions podcast today. Happy to have two people that we recently had on an MGMA webinar, and we will provide a direct link to that webinar, which is now on demand. But who we have here today is Dr. Miechia Esco, Chief Medical Resource Advisor at locumtenens.com, and Amelia Vietri, Senior Vice President and Partner at locumtenens.com. Really excited to have both of you on here. So let's just welcome you on here now. Dr. Esco, Amelia, welcome.
Thank you. Thanks for having us.
Yeah, thanks for having us. We really appreciate it.
Wonderful. So let's talk a little bit about your background so our audience gets to know you. Dr. Esco, we'll start with you. You're a board-certified vascular surgeon, and as I mentioned, Chief Medical Resource Advisor at locumtenens.com. Talk about moving into that locum tenens space. What inspired you? What excited you about that space to get you over on that side of the medical field?
Oh, yeah. I've experienced and practiced in just about every setting known. And then I became aware of locum tenens medicine, and it boils down to flexibility, autonomy, and opportunity, really to become more agile, versatile, a well-rounded surgeon, to really expand my knowledge and skill set in various environments while approaching different pathologies. You know, the interesting thing is, as you go around the country, you see different pathologies within the same field. You know, although I am a surgeon, I'm acutely aware that many of my patients in underserved communities have limited access to care.
Okay, well, thank you for that. Amelia, I want to bring you in as well. You've had a significant role in growing service lines at locumtenens.com. What have you seen as the challenges over the years? How has that evolved? We've had a lot of changes in healthcare over the last 4 or 5 years. So how has that been changing in your work?
Sure. So I have been with locumtenens.com for 16 years, and you're absolutely right. It has shifted over the last decade plus, and then the post-pandemic environment, I think change has just been rapid fire coming out of that. And one of the unique opportunities that I've had in my tenure here, I focused really on the recruiting side, but also had the opportunity to identify and grow service lines there where our healthcare organizations that we worked with were really in need of that expansion. And I think one of the things that is unique about locumtenens.com is that we're able to sort of connect the pieces at a broader level from maybe an organization having challenges on the West Coast, and we have experience with addressing those needs on the East Coast. And that expertise and that ability to solve for those challenges and identify market needs can happen rather quickly when we're dealing with organizations all across the country. And so one of the things that I think is really interesting as it relates to locumtenens.com and how we're expanding these service lines is that we've got over 25 years of experience, and we've had a job board for that length of time and have been building our clinician database for quite some time, and are able to really tap into some of the specialized resources that we have in the way of getting clinicians licensed more quickly, getting clinicians privileged more quickly, and really ramping up service lines that are in great need across the US at a much faster pace. And so as we've been able to do that, it was slow going at first when we identified service lines, but now we've done it so many times, we're able to replicate that over and over again as our customers identify needs in the healthcare space, and we're able to work alongside of them and be in the solution with them, and hopefully meet the needs of patients and expanding patient care a lot more quickly based on our expertise.
Yeah, thank you for sharing that. Dr. Esco, I want to turn back to you. You mentioned you have a background in a variety of different fields and aspects of healthcare, and I just wanted to share a couple of these. Background is in academia, military medicine, private practice. It goes across many different aspects. And so how does locum tenens address those particular environments, and how does it help address the challenges that practices may find there?
Yeah, that's a great question. I want to take a little bit of a step back and just how
Sure.
I approach patient care in these environments. I approach the patient, I'm a surgeon, but I approach the patients holistically, almost as a primary care physician, because I realize that many of our patients, their first and last interaction may be with the surgeon. So I really make sure, are there, screenings being done? Is there diabetes being taken care of? All of those things are really critical. In addition, I really look at social determinants of health and how I address the patients. The report that we did, gives great perspective and the similarities of differences in various environments. And, in academia, military medicine, community medicine, private practice, whether that's urban, suburban, or rural, we're finding these overarching themes of concerns with clinician retention, recruitment, clinician satisfaction, and various patient factors. Locum tenens is a very dynamic way of practicing. It goes beyond just filling a gap. It's a cultivation of partnerships to address environmental, clinician staffing challenges, to truly, as Amelia said, augment those service lines to really be an expert in taking care of our communities.
Okay. Now, you brought up a very important point. There's a research paper out there that's been worked on. Tell our audience a little bit about that research paper, what the intent was, and maybe a finding or two. And then I want to get Amelia's thoughts on that as well.
Yeah, just kind of a broad overview. We did a survey of about 200 people. Many were across the spectrum in medicine, but many non-clinical. And we really wanted to see in different environments, urban, suburban, and rural, what key challenges they were addressing and looking at those similarities. But then going further and breaking down the differences in those communities and how we can come up with really strategic solutions to solve them. Individually, but also collectively, because like I said, there are so many similarities. So I think one thing that was really interesting when I looked at the report we did and I reflected on my experiences in all of these environments is we have more in common. And I think key strategies can be implemented in all of them. Like I said before, we have these significant concerns with retention and recruitment, and also those patient factors that go across the board. And I think if those, highlighted items, say, for instance, are we looking at the cost of living and professional development opportunities for our clinicians? Are we looking at how we recruit? All of those things directly affect, how your system is working, regardless.
Yeah. Amelia, I wanted to get your thoughts on the research report as well. There are staffing shortages, as everybody knows. There is clinician recruitment that remains a top concern. So if you want to talk about what you saw in that report and share some thoughts on how that's being addressed through a locum tenens perspective.
Absolutely. So I think Dr. Esco makes a great point in that understanding there are more similarities in some of these situations than there are differences across all different types of work setting, whether it be rural, suburban, or urban. But one of the things that we're really understanding is that the rural setting is particularly challenged with getting resources as it relates to clinician shortages, a little bit more disproportionately than some of the other settings. And some of these situations, while they don't vary, and we understand that, cost and financial burden is a commonality across all sectors, each situation has a unique aspect to it in the problem that they're trying to solve in their healthcare organization. And specifically in the rural areas, one of the ways locumtenens.com really started to get involved and increase our efforts in bringing coverage to this area is through billing and enrollment education and opportunities. We've really focused in this area in the past year and understanding that many of our customers that we work with have a really hard time justifying different costs related to bringing in these resources. And what we've discovered is that most often there are clients that just really don't understand the way in which we can bill and enroll locum tenens providers to really help alleviate the cost and bring that revenue to their organization for the patients that they're seeing and the procedures that they're doing. And so this is one way that we've really tried to work alongside with our partners. The other way is, Dr. Esco mentioned the social determinants of health, but when possible, and when there's internet access and when broadband access is available, implementing telehealth and APP models, and even combinations and hybrid solutions with some form of having a clinician on site, but telehealth services to help do triage and help see patients and understand, and then APP as well, can really broaden the scope of services that are provided in an organization. And so those are areas over the last several years that we've really invested a lot of time and resources as a locum agency to bring that benefit to our customer base. And ultimately, with locumtenens.com, our goal is to improve access to healthcare, and we have really had some great success and benefits with some of these more hybrid solutions in the rural areas to bring that access and help bring in specialized clinicians that some of these organizations and communities have not otherwise had access to as well. So that's a little bit about what we're doing. I know we'll probably talk a little bit more in depth about some of those solutions, but high level, those are really where we're investing a lot of time and resources as we're solving this problem in rural communities and settings.
Yeah, thank you for that. Now, Dr. Esco, when you're talking about specialized medical fields such as vascular surgery, you also have a background in wound care pathologies. Does that make threading the needle even more difficult? Tell us about that when you get into the rural settings and you want a locum tenens situation to fill those gaps, as we're talking about. How are the challenges met there?
Yeah, well, that's the great thing about locum tenens, is that it covers every single medical specialty, even to the what we would call obscure, very rare. Because of the flexibility it affords across all career stages, so from early in the career to, into retirement, we can actually pull from that pool of specialists that may have not otherwise been accessible to those rural communities. We can provide critical needs for defined periods of time that we can really augment that strategically. So I'll give you an example. You spoke about the hyperbaric oxygen. Doing locum tenens and locum tenens as a field, it really affords the flexibility and opportunity to cross-train, to be very facile within your specialty, but also you can branch out. So I had the opportunity to become hyperbaric oxygen certified and really dive into that field. Even within vascular surgery, oftentimes, if you're in one area, you can be the specialty center for, say, endovascular or things like that. But in rural communities where those costs may be a little bit more restrictive, what you can do is say, hey, I have the specialty expertise to do it any type of way. And our clinicians, again, from very early in their career through retirement, have that flexibility to go in and to cover those specialty needs. Locum tenens clinicians are required to be deeply competent and agile to meet those specialty needs.
Yeah. All right. Thank you for that. Now, Amelia, I want to come back to you. You had mentioned telehealth and other emerging technologies earlier. Let's take a deeper dive into that. Did anything emerge from this particular study, other studies that you have, or the things that you guys are doing at locumtenens.com that are really speaking to that telehealth side of things and any other emerging technologies? Because let's be honest, I mean, whether it's AI or other different technology platforms that are out there, there are innovations that are taking place right now that are just incredible. And so I wanted you to speak to that if you could.
So the speed at which technology is moving within the healthcare field has just exponentially increased
Right.
over the last, I would say, probably 3 to 4 years, post-pandemic, post-Great Resignation. We're dealing with the effects of burnout and clinician shortages. And while we can't create clinicians faster on a faster pace, technology can be created at a faster pace to help enhance and also just expedite the rate at which we can see patients and the efficiency that we can gain with our clinician force. So we've really seen a lot of expansion, I think most widely in the telehealth space, like you mentioned. So telehealth was one of those things where should we not do it?
Right.
And I think based on the survey, one of the things that we saw is that overwhelmingly, we've seen that I believe it was around 81% of those surveyed had implemented some sort of telehealth option in their organization, which is a huge jump from where we had been probably just a few years prior. So I think this is one of the areas that we can continue to see expansion. Now, one of the things that I also think the survey kind of dives into is that we haven't necessarily perfected the effectiveness of how we're setting these programs up, how we're increasing patient flow, how we're achieving greater efficiency with that. So there's still some opportunity there. And I think that's where, organization partners come in and just really understanding from a consulting perspective, having, just those efficiencies and workflows looked at to make sure that you're getting the benefit of a technology that's being deployed. We often joke about the fact that all technology is not great technology as it relates to implementing it for your workforce. And so that's one of the areas I really feel like clinicians can be very instrumental in helping guiding practice administrators and people who are making these technological decisions, because that feedback is really helpful. Some of the technology offerings that we're seeing and we're hearing from clinicians that we're working with in the locum tenens space is that they're really enjoying the settings where things like AI have been deployed. There is help in terms of documentation, whether it be ambient AI, whether it be some sort of software or dictation software or something like that, where the learning curve on some of these electronic health record systems is not as great, and they are able to get in there and be more efficient more quickly. From a perspective of how we're assisting and helping with some of the organizations that we work with, we've been able to launch different types of technology as it relates to schedule management and assisting and sort of building some float pools, things of that nature, just to make scheduling and make the opportunity of moving resources across organizations a little bit easier through our technology partners, and then also offering just more advanced mobile capabilities. We understand that clinicians are on the go; they're not always in front of a computer, and so the more often they're able to do things from their mobile device, and the more often they're able to work in that manner, it creates a lot more efficiency for them on the locums front. So those are things that we're really doing internally. But I really think as it relates to the study, telehealth is really going to be just a continued advancement and extension of services that a healthcare organization can offer.
Okay. In our remaining time, I've got a couple more questions I wanted to address. And so one of these is burnout. Dr. Esco, I wanted you to share with us what you're seeing from the locum tenens side of things. You are directly involved with advancement of that to help the clinicians out there who may be dealing with burnout or may be on that cusp of getting burned out. So what are some of the practices that are being put in place that can help with that?
Yeah. The great differentiator with locumtenens.com is we really value our relationships, those personal connections with our clinicians to really understand what's important to them and, what's going on. So we really have those relationships. That's key. We have several continuous initiatives where we focus on the clinician experience. We really want to know what's going on. We keep our finger on the pulse of pain points and stressors that can directly contribute to burnout. As Amelia said, with technology, with, things mobile and just having the input of what would make the workflows easier to, limit burnout are some of the things we really focus on.
Yeah. And then just following up with that, when we really pinpoint that work-life balance, what does the locum tenens model do in that regard where it can help maybe that wouldn't be available in some other setting? So what does that look like for someone who does want that more flexible opportunity to do some work, but also really have a focus on work-life balance as well?
Yeah, it's funny in the locum tenens world amongst clinicians, we say that if you're doing locum tenens medicine and you're burned out, you're doing something wrong because you have ultimate autonomy. You have flexibility to create the schedule that works for you and your life. So, we really focus on, hey, what's important to you and how do you want to practice and how much do you want to practice and in what type of environments? If you want it to be super intense, for a weekend, a quarter, we have those opportunities. Or if you want to do it like I do full time, several weeks a month, there's a balance and doing that to create that work-life balance. The great thing is at any time within that cycle of when you're working, if you start to feel tired or burned out, there's the opportunity to step back and say, hey, how can I reassess this? And, our recruiters, our team is great about, really tailoring the locum tenens opportunity with our clinicians. So those are ways.
Yeah, thank you for that.
Sure.
So this is really interesting. Amelia, I want to direct this question to you, but yesterday I was doing some research on what a healthcare workforce trends look like in 2025. And one of those, it really speaks to what Dr. Esco was talking about, like how do we address issues related to burnout? One of those is to have a more robust staff in place. And one way to address that, and this is what was in that trend, is by integrating APPs, advanced practice providers, and other support staff that can be there for the physicians, for the clinicians. So talk about how do we get a better integration of those APPs? What are some ways to put that into place?
Right. So I think one of the things that we found overwhelmingly in the study is the recognition that healthcare organizations, particularly in the rural environment, but all across healthcare organizations, are really going to have to take a look at how they're utilizing APPs and what that structure looks like to help with that burnout and to help with patient access, because we know that there's more patients, but also the burnout piece. And one of the things that I think is really important here, and that is sort of an underlying of some of the conversations that Dr. Esco and I have had is around the communication as it relates to implementing APP models. You have to understand where the clinician pain points really are in order to implement a model that's going to work for the organization. We know that there is a perceived level of risk for physicians as it relates to bringing on APPs in a way that could potentially have them practicing at the top of their license, but may not be, that setting may not be ready for it, or what that may look like. And so communication is ultimately going to be key between hospital and healthcare organization administrators and their clinician workforce, specifically physician workforce. I think, we've seen, and we have many case studies at locumtenens.com where we've been able to do this successfully, whether it be through psychiatric NPs and bringing those in to help alleviate turnover and burnout. We know that in the behavioral health and mental health space, there's a lot of burnout with our clinicians post-pandemic. And so bringing in APPs has been a really successful venture in order to help with the burnout, but also continue access for this much needed patient group that needs access almost on demand. We've also seen it in the women's health environment and seen it with CNMs and offering midwife services to help take that first call for OBGYNs who are just burnt out working around the clock with deliveries and things like that, and offering CNM models for just that, those well visits, the checkups, the maternal care, things like that, and then also being on that first call for deliveries. So those are just a couple examples of the way we've successfully been able to deploy APPs in the healthcare workspace in order to just alleviate some of that burnout. But also, I think one of the situations that really comes into play is the versatility here of APPs and what they're able to offer as well. And so some of that cross-training, cross-function, we've also seen it so much in the critical care space where you have a critical care trained advanced practitioner who's able to, round through the ICU, who's also able to maybe do some of those specialty visits because of their advanced training. And so really understanding the pain points, the training and cross-training available for APPs, letting them operate at the top of their license and having that communication with the physician so that they can feel comfortable and that they can feel like they've communicated some of the pain points and that you're bringing in an advanced practitioner to help address that so things can run more smoothly across the practice, I think is going to be widely beneficial for healthcare organizations as they look to deploy APPs.
Yeah, I agree. I just wanted to really address what Amelia said. I think that APPs are absolutely critical to the future of healthcare and workflows for patient access, burnout, for everything. So I think it's a really critical factor in what we do.
All right. Well, I think that is a great place to end this particular conversation, but I wanted to say, Dr. Miechia Esco, Amelia Vietri, both of locumtenens.com, I want to thank you for appearing on the MGMA podcast.
Thank you.
Thank you for having us.
Thank you. And thanks to all of you for listening. And I did want to say this report, we will provide a direct link in the episode show notes. We'll also develop an article that will appear on mgma.com where you can read more about it as well. So until then, thank you all for being MGMA podcast listeners.